Dr. Denis, what is a dental implant?
A dental implant is basically a titanium screw that we use to replace your tooth. Now, I have other videos in which I can show you exactly what a dental implant looks like, but most of them are anywhere between 10 millimeters to 12 millimeters long. That's pretty tiny. So if you think about it, when you have a tooth missing or you have to have a tooth pulled, then that tooth no longer has a root. And what the dental implant is, it is basically that piece that's under the gum to support a tooth. So we take out your tooth, or if you're already missing a tooth, we place the dental implant in that place, and then we place a crown on top.
Is it painful?
Surprisingly, the procedure of a dental implant is actually not painful. I know that's hard to believe, seeing as that we're placing a titanium screw below the gum. However, remember, you do not have a tooth anymore. Therefore, there is no nerve. There are nerves that run through your gums, run through your jaw, and those are pretty easy to numb. Most people will say after that they had some tenderness or soreness of their jaw, which lasts maybe a day. That also depends on how many implants. I'm always surprised as to how little pain is associated with placing a dental implant. I've had a dental implant placed myself in addition to other procedures, and I'll say this, it was probably one of the least painful things I've ever done.
Why shouldn't I just get a bridge instead?
The reason that a bridge is not a good idea with replacing a tooth as opposed to a dental implant is, remember, if you have a tooth in front and a tooth behind that are healthy, we have to shave those two teeth down in order to place a tooth in the middle of the empty spot. So this is the way that we used to do it in dentistry when you had a missing tooth. So it didn't matter if the front tooth or the back tooth was fine, we'd completely shave it down in order to support a 3-unit bridge, or sometimes even longer. I've seen people with bridges from the right to the left. We call that a roundhouse bridge. Now, unfortunately, as time goes on and cavities start to form underneath the bridge, you can't simply just say, oh, I don't like that tooth anymore. Now you have to take the entire thing off in order to fix one tooth. So you have to think about now versus the future. And the reality is, as far as dental implant concerns, if you have one missing tooth, we replace one tooth. Even if you have several missing teeth, it makes sense to replace the one instead of involving teeth in front of and behind that may not have anything to do with it.
What is the process like, and how long does it take?
Now, let's talk about the procedure of dental implants. So the first visit is to actually place the dental implant. So we call that the surgical portion. I think that's a little dramatic because it's not that bad, but in terms of first appointment, that is the placement appointment. After the placement appointment, usually I'll see you in about 2 weeks as a post-op. On that day, we're just checking to see how you're doing. Hey, you feeling good? How was it? How did you heal after? And that's about 2 weeks after. Then we're just waiting. Now that process is called osseointegration. I know it's a fancy word, but osseointegration basically means we're waiting for the implant to become a part of you. That means the implant is inside of the bone, and the bone is wrapping itself around the threads of the implant to make it a part of you. And after that point, which is usually anywhere between 3 and 4 months, depending on the bone quality, depending on what the implant looked like at the time, we're just allowing that to heal. So there's a lot of kind of waiting period. Once that's done, then we start to take molds or impressions of the implant so that we can send that to the laboratory so that they can put a crown on top of the tooth. Again, I have many other videos as far as what that process looks like.
Thank you, Dr. Denis.